Okay, so hi everyone. Welcome to the Spring SSG Public Health Workshop. Again, my name is Dr. Jessica Liu. I'm a postdoctoral research fellow at the Reach Lab in the Division of Adolescent Medicine at Stanford in the Department of Pediatrics. That was my short intro. If you also want to introduce yourself in the chat, I already see people getting that going. So please just say your name, school, and then what you're curious about in public health so we can start to see what everyone's interested in here. Today, we will be talking about sort of why we're here, which is why do we care about health? What does health mean? Talk about that first. Then I'll dive into a little bit about my story and what got me into this field. And then we'll do maybe a couple of kind of mixed in activities throughout to apply what we're learning. And then end on talking about different careers and why public health is so important in a time like this. So, our goals for today are to define health and public health. We'll also understand fundamentals of a public health approach, familiarize yourselves with what's next in terms of pursuing a career in public health, and then also talk about methods of public health data analysis. I know a lot of people here are interested in data analytics, data science, et cetera. So I have built in a little bit of that in today's talk. So first, I want to ask you all, how would you define the word health? Go ahead and think about it and then enter it into the chat, what you think health is defined as or what is a part of health. Checking in on yourself, eating healthy, getting enough sleep, being happy, physical and mental health, absence of disease. Health means taking care of yourself, health span, balancing physical and mental health, feeling well. I love what I'm seeing in the chat. Thank you, everyone, for sharing. And I want to now share the official WHO or the World Health Organization definition of health. So, health is a state of complete physical, mental, and social well being, and not merely the absence of disease. Why is this so important, this specific definition? Because of the key phrase here that health is not merely the absence of disease. And this is what you all started getting at in the chat. It's the enjoyment of the highest attainable standard of health and how that is a fundamental right of every human being without distinction of race, religion, political belief, economic, or social condition. So a lot of you in the chat were writing about balance between mental and physical health, being happy. All of that is included in that definition of health. It doesn't just mean not having a disease. So all of you are on the right track. And this is the framework that essentially the entire field of public health really rests on. So it's great that you all are already getting that. Now let's talk a little bit about how I got into this field and why I'm here talking to you all about this today. So again, who am I? I already mentioned this earlier. I'm a postdoctoral research fellow or postdoctoral scholar. That's kind of both terms they use at Stanford to call a postdoc. And I study adolescent substance use prevention, especially in school-based settings. That's where I currently do my work and hope to continue to specialize. I'm also a first generation college student. I am the first in my family to go to college here in the US, and that has been a big part of who I am as an academic and why I'm so passionate about teaching and mentoring students. And another fun fact, I love teaching so much that it's bled into my fitness routine. And I'm also a fitness instructor. I teach spin, hit, yoga, you name it, bar. I just taught a bar class today. So really anything. And that's a big part of who I am as well. But what got me here to sitting here talking to you all about my career in public health, why I study public health, and how I've become the researcher that I am today. So this is a little bit about my public health journey and how I got here. So it started at UC Berkeley, where I was an undergraduate there, double majored in psychology and public health. I then went on to pursue my master's in public health at Yale in social and behavioral sciences, which then led me to the Harvard Chan School of Public Health to complete my PhD in population health science. Now I am, like I mentioned, a postdoc at Stanford in the Division of Adolescent Medicine and the Reach Lab in the Department of Pediatrics. What got me sort of really excited about public health was when I was an undergraduate at UC Berkeley. I started to explore my passion for public health, science, and teaching. I was introduced to the field of public health in a 700 student course that I took. And in this course, different guest speakers would come give talks on various public health topics, such as mental health, substance use, public policy. And at that time, I knew I always liked science and math, but I fell in love with this course. And more importantly, the entire field of public health and sort of the preventative nature and more holistic nature of public health. And what was also special about this course is that it was student led. So I then went on to serve as a teaching assistant, and then I became the course coordinator while also an undergraduate at UC Berkeley. So this early experience teaching a public health course at UC Berkeley solidified my passion in pursuing a career in public health. Meanwhile, as a young person myself transitioning to young adulthood at UC Berkeley, I was noticing what was happening around me in college and within my own social circles. I was surrounded by highly motivated, highly achieving classmates. I mean, I was at UC Berkeley, but I also saw a lot of young people around me struggle. Many of my friends were experiencing mental health issues and experimenting with different substances. And I had, people around me experiencing cannabis-induced psychosis, other mental health issues, and this was all very eye-opening for me as a undergrad student. And so I saw how truly, substance use during adolescence and young adulthood is so important to address from a public health perspective. And that's why I went on to continue my career in this field of substance use prevention, especially among adolescents and young adults. And the rest is history. So that's a little bit about my journey and what got me to where I am today. But another reason why I bring up the 700 student public health course I took at UC Berkeley, because again, that was my introduction to public health. Like before that class, I had never heard of the term. I didn't know what it was. Like I was basically, completely introduced to this field that was new to me. And I remember the very first lecture that I had in that course when I was a student was someone came and gave a lecture on just sort of what is public health, introduction to public health. And they used this metaphor that I'm now going to tell you right now. There's this story that there was a village, and in this village, there was a river. And one day, the people in this village noticed that there were babies floating down the river. And the people in the village were very concerned because they saw that these babies were floating down the river and wanted to save them. So they started pulling them out of the river. However, one person in the village was like, we're pulling all these babies out, but they're still coming. So that person went more upstream to try to figure out what was causing all of these babies to flow down into the village. And that person going upstream is the metaphor of public health. It's figuring out what is the root cause, the more upstream cause of a health issue. Now, you're all probably hearing this metaphor like, wow, why is it babies floating down a river? I totally get that too. Again, I not the hugest fan of the upstream, downstream metaphor using this story that I don't even know if it's still used, but it's the story that I was told 10 years ago, 10 plus years ago at this point. But that idea that upstream is sort of thinking more about social determinants of health, which we'll talk about in a little bit. And then the more downstream approach, again, the pulling the babies out, kind of when it by the time they've gotten to the village, that is more sort of your healthcare response um, and treatment. So I want to challenge everyone here today to think of a better and more appropriate metaphor. Um, if it's helpful, I want you to draw it, but I want to put you into breakout rooms right now to essentially think about this, and then we'll bring it back and share with the group what you came up with. Going to the root cause by looking at the roof, not just mopping the water. Exactly. Okay, you all are getting it. Great metaphors. Yes, checking the conveyor belt if the car's not being built correctly. Yeah, perfect. You all got the idea. Anyway, we can sit here thinking of metaphors probably all evening, but I do want to keep moving forward and talking a little bit more other aspects of how to conceptualize public health besides just upstream versus downstream. So, a big component of public health is understanding social determinants of health. So, what are different social determinants of health that aren't just disease? And these are kind of the things that some of you started hinting at when trying to understand what the root causes are. So, I'll go around the little wheel that you see here. So, these things can include economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. So when you're going to that more upstream place, when you're looking at, what's causing the leak, what's causing the traffic, whatever's causing it, these might be some of the social determinants of health that you want to look at. And in addition to these determinants of health, it's also important to think of health being influenced by multiple layers of influence. Now, this is part of the socio-ecological model, which is frequently used in theory when talking about public health and public health approaches. So that's the idea that you have an individual, that's like a person, and you're probably thinking about, okay, how am I going to improve that one person's health? Well, it also depends on their interpersonal surroundings, so their relationships, the people, their household, what's happening sort of among the people around them. Then you have the organizational level. So that also exists within, okay, is this person going to a work? What is their workplace like? What is their school like? So what is the organizational level, and how does that influence all the way down to the individual person's health? And then beyond that, you have the community. So, what's the sort of local environment in which that person lives and the community in which that person lives? And then ultimately, all of that is within sort of this macro level of sort of policy and social norms. And all of that trickles down. The policy, the community, the organization, the interpersonal, all affects just one person, individual health as well. When I was a public health student, where there were these little stickers that said, "This is public health." And the idea was that almost everything could be public health. But most commonly around my UC Berkeley campus, people would put the sticker on like hand sanitizer, stands, or like, that kind of more direct hygiene related things, but also public transportation, or essentially anything that goes back to this little wheel of social determinants of health, which really encompasses a lot. So I want you all to now think about what you see in your day-to-day life and where might you put this sticker. So think about that and then type it into this chat. So what are you seeing in your day-to-day life that might already count as public health and you might not even know it? Okay. Bike racks, definitely, because biking is, more eco-friendly transportation. Parks, yes, that's definitely a form of public health. Water fountains, absolutely. Instant cleaning public bathroom stalls. I have not heard of that, but that probably sounds important. Farmers markets, absolutely. Public libraries, mental wellness centers, absolutely. You all have the idea. And these are things that you are probably seeing and walking by on your day-to-day basis. So thank you, everyone, for sharing this. Now, as I promised, I do want to talk about careers in public health. So, what can you do if you want this to be your life and your career that you dedicate your careers to? So a huge step in embarking on a public health journey, you can get a undergraduate degree in public health, which is what I did. And you can also get a master's degree in public health, which is an MPH. This is a 2-year professional degree that includes coursework, um, research and or thesis, and a summer internship. Some programs might be a little bit shorter than this, but generally it's like about, on average, a 2-year program that you complete after doing your undergraduate in public health degree. And there are a lot of different things you can specialize in within public health that include community health, social and behavioral sciences, epidemiology, biostatistics, health policy, and health administration. And these all can lead to various careers in the field of public health. So, in applying to MPH programs, you can apply right after graduating from your bachelor's, or you can do it after working a few years. I actually applied after working 2 years after graduating from UC Berkeley. I worked in two very different, very corporate jobs that had nothing to do with public health, but I was still able to draw upon my public health experience and my teaching I did as an undergrad and use that and applied and got into Yale for my MPH. So you can definitely work, and it doesn't have to be exactly in the public health realm in order for you to do that. And who can apply? There are no prerequisites really for public health courses. So really, you can come from any field in undergrad and then apply for a master's in public health program. And you don't, again, need super extensive experience that's specific in public health. If you are trying to pivot from sort of a similar field or even a not that similar field, but you have that interest there, it is totally possible. As we just mentioned, everything is public health with those little stickers. So really, it's not hard to link, your existing experience with public health. And you do need to take the GRE, which is, the graduate school standardized test. But a lot of programs have made that optional now. So if standardized tests are not your thing, don't worry about it. And the deadline for these applications is roughly December of every year. And some have even rolling applications that you can apply as late as, April or May, the summer before starting the program. So I would just look specifically at which schools, which programs, and what their deadlines are. I'm also seeing some questions come in through the chat, and I'll answer those at the end or just when I think it's appropriate, because I'll get to some of this soon. To continue talking about applying to MPH programs, more about things that you'll need. So a lot of the MPH programs, they're housed within this central application platform called SOFUS. And you can just go there, essentially build your whole application, and then send it off to multiple schools. So it's really convenient. You need, I believe, 2 letters of recommendation at minimum, a personal statement, your CV and or resume, and again, a GRE if the school requires it. And usually there are application fees for each school or each program you apply to. But you can look into seeing if those can be waived for you if you have sort of financial needs for waiving that fee. And kind of on that same note, two important things to consider when thinking about an MPH program is the cost of attending the program and the tuition cost. Again, a lot of schools do provide financial aid and merit-based scholarships, but it's not super abundant. So you'll want to make sure that, this is something that you can financially support yourself through and that that's not going to cause you stress as you're completing the program. And important to also think about location. Where do you want to do this, um, master's training? I thought that I was ready to leave California and experience something on the East Coast, but I missed my home. I missed California so much when I was at Yale. It was a tough transition. So think about where you are, where your family is, where you want to be. And that's really important to think about too, as you think about where you might want to go for your graduate school. And now, okay, why do a master's in public health? Why go into public health at all? So here are some careers in public health. And these positions, some are possible with an undergraduate degree in public health. Some are possible with an MPH, and some you do need a PhD to do. Those are a little bit fewer on the list. But I'm going to go through some examples of types of careers that are possible in the field of public health. So, of course, you can do research, you can become an epidemiologist, and you can become a data analyst, especially for a lot of you who are interested in research, data science, statistics. This is a possibility for you at really any level in terms of bachelor's, master's, or PhD in public health. You can also teach or be in academia. That's what I'm doing. Depending on the level, you might need a master's degree or a PhD or a doctoral level degree in order to do so. You can work in consulting, whether that's general consulting, health consulting, or policy consulting. A lot of my friends and colleagues went into consulting after graduating from their master's programs. You can work for a nonprofit. You can become a program coordinator or a community health educator or health director. You can work for a government organization. You can work in hospital administration, for example, at a large health system like Kaiser throughout the Bay Area. You can work in health education or health promotion. You can work for health tech or be a part of a startup. A lot of people I know also pivoted and did that, especially those who were at Harvard. In my master's level classes, a lot of my colleagues went into health tech. So that's definitely possible. A lot of students actually will major as public health in undergrad or get an MPH and then go off to law school or medical school or nursing school or some kind of other non-public health graduate or doctoral program. And that is a very common path as well. And then finally, especially in times like this, doing policy or advocacy work is also a great avenue from public health degrees. This is data from the University of Michigan and their MPH program and what their graduates of their MPH program tend to go off to do. The University of Michigan has one of the largest and most well-ranked MPH programs here in the US. And they provide this data publicly, which is great. So you can see that about 30% of their MPH graduates go off to become a hospital or healthcare provider. So that's going back to, people going to medical school or nursing school, et cetera. About 25% go off to academia. So that's kind of similar to what I'm doing. So that's research, teaching, being a professor, et cetera. About 10% go off to work for the federal government, US or foreign. 9% go off to other industry or commercial firm. 7% go to pharmaceuticals or biotech. 6% go to some sort of association, foundation, NGO, nonprofit. 5% go into consulting. 2% go into some state health department. 2% go into health insurance. And then the rest kind of is 1% self-employed, military, state government, or local health department. And this next point, I really want to just discuss with you all, which is why we need public health professionals now more than ever. With everything going on in the US right now, I'll just put it like that. We truly do need now more than ever highly trained public health professionals. Our lack of emphasis of this in the government is really creating a need that will need to be filled with future public health leaders in this space. So, this field is going to need to address the lack of trust in public health and science, and we need people ready to address these challenges. We still have public health problems here in the US. It's not like our population suddenly just got healthy. We have, a lot of those issues with social determinants of health causing a lot of problems still, and they will persist. So we definitely need public health professionals now more than ever. Um, and there will always be jobs, you know, need and huge, huge need in this field and this sector. So just wanted to share that with you all so you know that public health is still relevant and still extremely important. And now a little bit about just to end on data analysis in public health, which is something I know that a lot of you are interested in, is how sort of data analytics, data science may play into public health. And it's actually quite important because public health is all about looking at data and analyzing data. That's what I do with like so much of my time. So there's kind of two elements of public health data analysis, and that's qualitative data and quantitative data. So I'll talk about qualitative first. So qualitative data is more sort of the the words, the non-numerical data that you look at. So that can come from interviews, focus groups, talking to people, content analysis, so looking at images. I've done, kind of reviews of social media content. That is all sort of qualitative data for public health. It can also include program evaluation. So if you design an intervention and you want to see how it's being implemented in a community, qualitative research can be really important in understanding and evaluating that program and its effectiveness in a community. And that brings me to that last point of community engaged research, which is actually partnering with community members to do your research. And that's a huge part of public health research too. Now, on the quantitative side, there is a lot of sort of crunching numbers, in my opinion, when it comes to public health. I spent a lot of my master's program as well as my doctoral training living inside of different programs. In my MPH, I learned how to use SAS. I did not like that. For my PhD, I learned how to use R. Didn't like that either, but had to stick with it. And after really just sort of brute force learning how to use R, I can sort of use it now. And so that's what I live in sometimes. R is sort of my coding language. But people also use SPSS and Python for their research as well. Again, a lot of public health is studying epidemiology, which is understanding the spread of disease and those numbers. And there's a lot of epidemiological terms I won't get into today, but that is a huge part of the quantitative side of public health. I do a lot of regression models, longitudinal analyses, so looking at data over time as well as across different levels. And becoming more and more popular within the field of public health is understanding how AI or machine learning can, improve our data analyses as well as the interventions that we are creating in public health. So I just want to end on sort of why I love my career in public health so much, if that hasn't come across already. Again, I really do feel like the work that I do impacts people at a population versus individual level, and that the work that I do is impacting many people, not just one person. I really love working in adolescent health. I love working directly with youth, and I include them in my research. I have my own youth action board that I go to work alongside for my research projects, and it's so great being able to promote adolescent health and empower adolescents in the meantime too. My research is also directly informing interventions in policy. I've even testified in front of the Connecticut State Senate to present my research, and that was really exciting. And then finally, it is so much fun. I truly love um, doing what I do. Like I said, I get to work with passionate students like you all the time, come up with research projects, learn together. And it has truly been so rewarding. And I feel like I'm one of the few people who gets to say that I get to go to bed every night excited to wake up the next morning to start my day, another day in my public health career. So because of how much I love, working with passionate students like you all, I've actually created my own YouTube channel called Office Hours with Jess. I can send you all more information about this soon. But this is a resource that's kind of taking what I did today and just has tons more resources and videos about all the intricacies of a career in public health and how to apply to master's and PhD programs.